Mogul Motivation, empowering and inspiring entrepreneurs and dream chasers worldwide, 1 week at a time. Presented by True Stories Media. And I'm your host, Antoine Twiz Taylor. Dr. Betty Allen didn't choose medicine. Medicine chose her. A lot of people have mentors and inspirations in their chosen field that they go into, their profession. She didn't have any of that growing up in Harvey, Illinois, but on this episode of Aspire Higher, she's going to tell us how she overcame all the obstacles in high school, undergrad, graduation, and med school to get to where she is today and where she ultimately wants to go in the future. So without further ado, Dr. Betty Allen. At what point did you decide to become a doctor?
Oh, that is a really hard question for me to answer because I was a very, very young age. I would say that.
Okay.
I would say in elementary school.
Wow.
I always knew I loved science. Yes, I was always, you could ask any of my siblings or my mom, I was the one digging in the backyard, like exploring things, looking at bugs and reading. And I knew I wanted to do something in the sciences. And I just enjoy learning, like, to be honest, like I enjoy learning. I enjoy like figuring out how things work. Mm-hmm. And I would say really towards the end of elementary school into middle school is when like I knew I wanted to be a doctor because I love the human body. Like I started to, read like how our bodies function.
Yeah.
And it sort of went there. And I saw the movie Something the Lord Made. It is, I don't know if you've ever seen it before. Yeah, so Mos Def plays Vivian Thomas. Vivian Thomas, in this day and age, would be a surgeon. But at the time, this was during the 1950s, because he was Black, he's what we call a surgical tech. He was just a technician. But he is the one who discovered the first surgical procedure for a congenital heart defect. So after I saw that movie, I mean, I was blown away. And it was that I saw myself in his shoes. Like I saw myself doing that operation. And I think for me, that's when not only did I know I wanted to be a doctor, but I wanted to be a surgeon.
So it's kind of like you didn't choose this field. This field chose you. That's Absolutely. What it sounds like.
Yes.
Wow.
Yes.
Because at a very young age, you was just infatuated and, just like, I don't like to use the word obsessed, but it seems like you was obsessed with just seeking knowledge on how things work.
Yeah. Yeah. Like I was like, I mean, like my older brother Antonio and Cleese, they used to call me weird. And like Cleese would always say like, well, you have to read everything. And I would read the back of like toothpaste, the toothpaste bottle, cereal packaging.
I used to do that when I was bored too.
Like, I wish it was in here. Like, how do you know it's in here?
Yeah.
So, I would just always like trying to figure out the nuts and bolts of things. And it just rolled, spiraled into the human body, and I just hooked on it. And it's just been that way ever since.
Now, was anyone in your family involved in the medical field or no?
No. But I would say my cousin Tanisha, she is a nurse in the military. So she's probably the only connection to healthcare, but I have like no professors, no doctors in my family.
Wow. Okay. So
yeah.
So you made like we said, being a doctor, being a surgeon chose you at an early age, right? That's what we're going to roll with.
It did because like I had no exposure.
Right.
I had no idea how you even go about trying to be a doctor, like knowing the right people, knowing like what to, like the different books I need to study, going to the best colleges, like, like I had no sort of help or guidance on that. And I know a lot of people in my profession, they do, they've been blessed to have parents, uncles, or a family friend or a colleague of their parents who are physicians and surgeons, and they're able to have access to that world where I didn't. I pretty much, just ground from the bottom and just try to get as much experience like through shadowing and talking with physicians and doing anything in the healthcare, volunteer opportunities that I could. And that's pretty much how like I kept myself connected to it.
Yeah, so let's dive a little deeper into that. So
Yeah.
how does a young black woman from Harvey,
Mm.
Illinois, with no type of medical professionals in her family or probably in her community, how do you
Yeah.
navigate that? Like, how do you keep that dream alive? And you say, and you tell yourself, I want to be a doctor, so I need to do this, I need to do that. How did you navigate through high school and ultimately into college, which I'm sure you majored into something in
Yep.
your major dealt with medicine. How did you get there? Like, how did you navigate through all
Yeah.
of that?
Oh, so I would say in high school, about sophomore year of high school, I kind of knew, I wanted to be a doctor, but I also knew I decided in my mind very like early on about the universities I wanted to go to, and they were pretty much all heavy research buildings. I mean institutions. And I knew that they would be good for me in terms of being like the next stepping stone and help me to get into med school. So I chose, honestly, I chose Ivy League and private schools to apply to um, for college, for undergrad.
Yeah.
Which you don't have to do. Anyone who wants to be a physician, go to the school that you're gonna love, that you're gonna have fun, that that you're gonna get the best education, um, and just work hard. That's what I did. I still work hard. I was blessed to be admitted to the University of Chicago. So I wasn't far from home, but it was, it's a really good school that we have in our own backyard.
Absolutely.
Yeah, so I went there. They're obviously big in biology and medicine. So I did some shadowing when I was an undergrad, and I shadowed a pulmonologist because I love the heart and lungs, and I want to be a cardiothoracic surgeon. So shadowing, I remember Dr. John Kress, like he, when I went with him to see his patients, I shadowed him like every week. I mean, it was a highlight of my time in undergrad. And that's despite having the chemistry and the physics and the organic chemistry, all those mundane courses, honestly, that I hated.
Yeah.
And that are really weed out classes. I know so many of my friends from college didn't make it through because of those classes. And shadowing a doctor really gave me that motivation. It was like the light at the tunnel. And because I could see the end product, it pushed me to get through those classes. Because those classes are no joke.
I bet.
But it is doable. It is doable.
I was a broadcaster major, and I look back and similar to what you just said about how a lot of those classes were mundane. I feel like a lot of people have to take a lot of mundane classes that they don't really care about. It's like your major right. is what you care about. And I feel like that's universal across all different types of fields. So I felt that when you said, you had to go through all these mundane classes, and even though it wasn't, all those classes you had to take, I mean, I ain't have to. I definitely wouldn't have made it. I ain't gonna lie, I wouldn't have made it. I would have been done after a semester. But relative to my industry, they were mundane, so I get it. But your drive is what kept you pushing through it, right? Like you said, you know what, I gotta go through it as part of the process, so let me just stick with it. And I think that's beautiful because so many of us, we lose that drive because of those mundane,
it is, and I would exactly, and it saddens me honestly to think about it because I did not do stellar in those classes like at all. To be honest, like I did not like when I graduated from the University of Chicago, my GPA was barely a 3.0. I would put that out there. Like it was a struggle for me. And I really didn't start to like recover until like the middle of junior year and then senior year. But it was those courses, and it can be really depressing too, because it's like, that you have to take these courses to get to the next level, right?
Yeah.
But they are it's so much information, and it's like and it's nothing you've ever experienced before, like in high school, and no one prepares you for it, and you really don't have a lot of help, honestly, unless like some of us, we created study groups, but really you don't have that that's that support you have, I guess I would say, when you're back at like your home school, like at high school, where everybody you grew up with was there.
Yeah.
You don't have that. So it was really depressing, going through that and just trying to stay motivated.
And let me ask you this. Were there a lot of blacks in your classes? Were you always the minority in these classes?
I was a minority in this class. There were other African American, Hispanic, let me see, Indian, South Asian students, but it wasn't a lot. I would say in terms of black, that I was like one of maybe 10, I would say. Sometimes in some classes, I think others a bit more, but.
And I'm sure that can add another level of, stress too. And I'm not trying to, I'm not trying to make it a race thing, but let's just be real. Race is real in America. So, I can only imagine having to go through all of that on top of the fact you can't really even relate to other people, like you just talked about support. I'm sure like some of your classmates from Asian descent or European descent, they probably had friends, or people that can relate to, their backgrounds and their past that they can, band together with. So I think that's very admirable that you was not only able to push through those mundane classes and even your major classes, but on top of the fact you were isolated, like you said, in some cases.
Yeah. Oh, honestly it was. And, it really was a grace of God that I got through. And after that, because my GPA was low, and I took the MCAT. The MCAT is the admissions test for med school. Okay. That was not great either.
You didn't pass, or?
I passed it, but it wasn't like
stellar.
Now it wasn't stellar. It wasn't like the 30s. I think what it is now, where they want you to be. Okay. Honestly, I think the first one I took was like 18 or something like that, which is pretty low.
You know what? Side note, it just dawned on me. I first learned about MCATs because of Meet the Parents. Ben Stiller's character, he had to take that. He kept talking about, he got to pass it. Yeah. So it just dawned on. Okay, so now we're at the Meet the Parents stage, right? Not literally.
Exactly. Meet the Parents stage. I'm trying to figure out, how do I get into med school? Right. And also, remember, so we graduated from college in 2010. The housing market crashed.
Yeah.
So
yeah, it did.
I think in our generation, we forget that. Like, we went through like one of the worst economic, like, disruptions, crashes, whatever you want to call it, since the Great Depression.
Yeah.
And that affected my family. And we were, we're super poor. Like, my mom's a single mom. It was 7 kids, 7 of us. Like, we were constant, we moved from different houses throughout Harvey. And then we finally ended up in Dalton. But at the time, we were still living in Harvey. And we finally moved to Dalton. My mom was able to buy a house right before the market crash. But then, she started having trouble, with the house. And I graduated and could not find a job. Graduated with a degree from a prestigious Ivy League institution and could not get a job at Walmart. And I applied for Walmart. I applied to be like the cart collector.
Yeah.
So, because I was going to work while I studied for the MCAT. Could not get a job. And then, and that was also a hard time for me. And it was a lot of crying, a lot of tears, because I knew that being a doctor is my dream. And again, it's like, how am I going to get there?
Yeah.
Like something else now I have to go through. But, I did a lot of searching, praying, meditation, and something told me to apply anyway. Just apply. So I took the MCAT again. This time I got a 26.
Huge jump.
It was a huge jump. It's a huge jump. I didn't have a job. I'm just going to study. I studied, and I did the best I could, to help my mom, with the bills and everything. I retook the test. I got a higher score, and I applied for med school, and UIC gave me a position. So that, I think, and that's like one of my greatest moments in my life, honestly, that I was again in a dark place and could not figure out, the way to go. It's like the end result is in my mind, of course, because I did so many opportunities. But it's like, how do I get myself there? You know, with my give it who I am and all the things I have and the things I don't have. How do I get to the end result? And it was just, honestly, I think it was just divine intervention for me. Like, I didn't do anything special. I didn't know anybody. I just tried again. I studied hard the next time, and, you know, it worked out. UIC, they have this wonderful program. It's through their urban health program, which I highly recommend for anybody who's thinking about med school and they don't have like the best scores or the best grades. The urban health program is, they have this post-baccalaureate program. It's for 2 years, where it's like you audition to be in med school. They put you in the same classes. And depending on how well you do, if you get a C above, then you get an automatic spot in med school. And I did really well there. Pretty much got all A's, and I got, you know, a seat into med school, and I did really well in med school. I graduated the top 15% of my class.
Wow, beautiful.
Thank you. Yeah, it was like that. I would say med school like really was like the best time for me, because it you know, it showed a side of me that I didn't know. I didn't know I could be that tough, because I really am a softie.
We all have soft sides. We all have soft sides.
We do, you know. But you know, I stuck with it, and I think for all of you out there, being a doctor is hard in America. Like, it is so hard, and you know, people will tell you all different things to do and who to go, you know, who to talk to and where to go, but you just have to stick with it. You know, stick with it. Do the best as you can, and look out for opportunities that you know that will put you, sort of get you to the next spot. And the urban health program at the University of Illinois really did that for me. And I sing their praises all the time.
So, what year did you what year did you get the 26 on the MCAS and get into UIC? So
I took, I want to say my age now. Got me counting back, bro. So in 2010, I graduated at University of Chicago. So I would say, so it was that summer, a few months after graduation.
When you got to 26? Yeah. Okay, and then you got into UIC that fall?
No, it was the next year.
Okay, so 2011. 2011, then what year did you graduate from there?
So the post-grad program 2 years. So I started med school in 2013, and I graduated in 2017.
Right, because med school is like a whole lifetime, right?
Pretty much, yeah.
So you graduated from UIC. Now you're officially a doctor at this point. Is that how that works?
I am. I'm a doctor.
Okay. So you're officially a doctor once you graduate from med school.
You are. You have an MD.
You have an MD.
Right, but you are not board certified or licensed.
Okay, tell us about that.
Exactly. So medicine's a long process. So after med school, you graduated with a Doctor of Medicine. That says that you have acquired the knowledge to treat ailments that affect the human body.
Okay.
But in the United States, you need a license, and you have to be board certified in a specialty that you want to practice in. So to get the license, we take more exams. It's just an exam, whatever state you're in, where you get that license. And then to be board certified, like since I want to be a surgeon, right now I am in surgery residency. So I am a surgical resident, and this is for 7 years.
4 to 7 years?
It's 7 years.
7 years. Okay, board residency. 7. And is that like a like an apprenticeship in a sense, or what is that? Is that okay?
It is an apprenticeship where we do operate with the faculty or the attendings that you see. It's sort of like Grey's Anatomy in a sense.
Yeah. Okay.
The only sense where they started off as residents and they're like following the attendings around and talking about the plans. So that's what we do. And then as each year we step up and we do more of the operation with the attendings, we get more responsibility, more autonomy in the OR. But
right, so
everything
it's
is
like
safe, they're still there.
they're acclimating
Exactly.
you bit by bit, and you choose the field that you want, like the specialty you want to go into, right? Like after, okay, so you're a surgeon resident right now.
Yep, I
and
am.
and where are you based out of? Like what hospital and things like that?
Yeah, so I at the University of Wisconsin Madison.
Okay.
Program of general surgery. So the way this works is I do general surgery for 7 years. And then since I want to be a heart surgeon, there's another program called fellowship, and that's for 2 years. So right now I am in my, I guess you would say 4th year in residency, but it's really called 2nd year because we take 2 years off to do research.
Okay.
And then at the end of this summer, I go back and I complete by the last 3 years of general surgery training.
And the residency is all at the same place, correct?
It is. It's all at the same place.
And it's kind of like so in a sense, University of Wisconsin hired you, quote unquote.
They did. Yep. It's still like a higher, like I still get a salary, correct, with benefits.
Yeah, that's a major key.
Is major, man, major, especially after you've been, in school for like most of your life. We are salaried. We are hired by the university. Like, they have insurance, for us, like malpractice insurance. But again, we are in training, so they call us trainees. So I'm training to be a surgeon and training to be a heart surgeon.
Wow, heart surgery. So like not just surgery but heart surgery. Like let's talk about heart surgery and like as it pertains to just the general population, but I kind of want to focus on Black Americans as well. Why are we so at risk when it comes to diseases such as heart disease, stuff like that? Like, can you explain some of that for us?
Sure, I sure can. So it is a multitude of factors. It is, diet, lack of exercise, and sometimes for us it's a lack of a place to exercise, not being able to afford going to the gym. Being in places like, Harvey, where there's like no grocery stores, like food desert.
Yeah.
Not having adequate, food, not even let alone organic food. Yeah. Exactly. We don't have a lot of grocery stores. So not even having, access to like good food. You don't have access to just like regular fruits and vegetables. Smoking, alcohol, all of those things affects, the cholesterol content and, in your blood vessels. And then with stress, racism, that increases your blood pressure, all the trauma, all of the things that we go through, it accumulates in our bodies.
So racism really kills.
Oh, it does. Absolutely.
Really kills.
There was a big, to go off of heart disease, there was this big study in Florida that came out that showed that babies born having white OB/GYN physicians have a higher mortality rate. So they have a higher risk of death than white babies born to white doctors or white babies who are born with Black doctors. And that Black babies who have Black doctors survive. Wow. So racism is real, and it's real in healthcare. It's always been there. Wow. But we're just really finally, seeing it, and they're finally believing it.
I was reading a book titled Medical Apartheid.
Apartheid, yes.
Changed my life. It changed my life.
I probably got to like half that book in one sitting because I just got so angry.
Yep, same here. Same here.
Some time for me to read the rest of the book. Because like once you see things and you see how this system has pervaded all aspects of our lives, and being Black, including in the healthcare system, like it's almost like what hasn't been done. You know what I mean? Like,
yeah,
what else can they do to me? You know, what else can they do to us that they haven't done already?
yeah.
And you just see how we've been set up to fail. You know, and I'm just blessed. Like, I wish that my story wasn't unique. You know what I mean? Like, I'm just blessed I was able to navigate this, because it's been hard. I didn't have, again, any exposure, any guidance through it. I just did the best that I could. But yeah, all the societal, environmental, genetic factors come together. And for us, because a lot of us, are afraid to go see doctors, as we should, because all the things that have been done to us, we may not go when we feel pain. We may not go when we start having chest pain. And then once we finally do, things are even worse than when it started. So, a lot of the problem, the healthcare system really has to change. If they're really going to be serious about affecting change for Black and people of color, then the system has to change. Because they created this issue where we are afraid to go see doctors. We are afraid to get healthcare because we don't know what's going to happen to us. And it's a problem that they created. Yep. So I always say, like, if they want to fix it, like, we can't fix it. You know what I mean? Like, you have to fix it. So,
it's kind of like my grandma, rest in peace. When she was in a nursing home about 7 years ago, when she first got admitted to the nursing home, she raised hell because they gave her a white nurse. Because they gave her a white nurse. And, I knew why. You know what I'm saying? But the older I get, the more I read, like we just mentioned, medical apartheid, the more I read books like that and, other books like it, like Killing the Black Body. That's another book I've read. The more I take in this information, I see why she raised hell. My grandma at the time was she was like 87, 88 at the time. Ain't no telling what she's seen in her day.
Exactly.
And, I'm not against the COVID vaccine, but I understand why so many Black people are.
Oh, absolutely. I do not.
I understand why some don't want to take it. I get it.
I get it 100%.
And I haven't taken it yet. You know what I'm saying? So I get it. There's no really right or wrong answer, but I just don't think people can really be angry at others for feeling the way they feel when it comes 100%. To that.
100%.
Because
and like I said, the United States healthcare system created this problem, and now that there is a public crisis, they expected people to change. Like, it does not happen that way. So I agree 100%. Like, never push treatments or anything to anyone. It is the patient's right to refuse anything that they want, regardless of what we say. When patients tell me they take, like, holistic medicines, I'm like, oh, cool. Which ones? Tell me. I'm into that. You know what I mean? So, I want to get down. So, sure. Like, I just ordered me some sea moss. Taking my elderberry. Yeah. Like, I don't. Because, like, because I always enjoy learning, like, I know you never know what's out there in God's creation. Just because I can't prove it in a science experiment doesn't mean that it's not real. It's just that we haven't proved it yet. So, I'm always open to learning and open to new information. And I feel like all physicians, we should be that way.
So I got two questions to piggyback off that. Piggyback off a lot of points. I have two questions. The first question is about the system changing, right? What's more important for the system to change? Is it getting more Black Americans into the medical field, whereas, whether it's healthcare professionals or on the administrative side, or is it more so on, people that aren't Black realizing how things are and, taking initiative to change it? What do you think is more important?
That's a hard question. Oh man. From my experience, and this is just this is my opinion, and from my experience right now, and I think the quickest and most efficient way to get things to change is to have more people of color as physicians, nurses, administrative staff, like throughout the whole hospital.
Okay.
Because the level of distrust is still is almost like insurmountable. So I think the more we see each other, the more we can start to be able to trust. I think honestly,
right.
I think trying to change people's minds is going to take a long time. And this couple of years has showed that. And I don't have time to wait. I don't have time to wait knowing that people look like me are still dying because of people who don't look like me. So we need to do more to bring Black people, Hispanics, Latinx, Native American, Indian, every person of color, more higher population into the medical field. I think that's the fastest way to do it. Where I'm at now, like I'm the only African American female resident, and there's only at first there were 2 Black men. They hired 2 more, so it's 4. So it's only like a handful of us, and
you're the only woman.
I'm the only woman. I'm the only woman there. Yep. And they've only had 3 in the whole history of this university. In
the whole history.
Yep, only had 3.
And University of Wisconsin, I'm not sure the numbers, but I'm sure it's been around since the 1800s.
Yes, it has been. As you can imagine, any university. Yep.
It has been. Like one every half century. It sounds like. Wow.
Pretty much.
Wow.
Yeah, I mean, it shows you the culture. It shows you, the priority. But now, because they are hearing us loud and clear, finally, they're taking us seriously. So they really are recruiting, and they put me on a couple of committees to increase the diversity and also to retain. Because sometimes, it's hard to stay in certain places once you get there.
Yeah.
So you got to recruit and retain.
Yeah.
And it's been a real joy to be a part of that process here. But it takes time to change people's minds. So, I think the best way to get change right now is to have more of us, whether they like it or not.
What are some quick tips you can give people to just try to live a healthier life, try to keep their heart strong, regardless of the age? What can they do?
What I said, it's twerking.
Twerking. That's good exercise.
That's provide good cardio.
I heard it's a good exercise. Good cardio, all that. Just like hopping. Hopping,
cardio. Really? And that's hard. I would say, like, I know, like, the food places that we have. If you can, try to, even if it's canned, try to eat as much vegetables as possible.
Okay.
Eat fruits, apples, oranges. They have a lot of fiber, and it's really good. It really cleanses you out. Let me see. Exercise is always big for people. It's always hard to do. If you can, if you're in a place where it's safe for you, I would say do a walk, a jog. And I've been telling my mom this, at least walk around, do a power walk if you can. And it helps a little bit, really, goes a long way, and things will start to chip down. The weight will go down. Your blood pressure will steadily go down, and drink water. Like, water is still so underrated. Drink as much water as possible.
Water is the GOAT. I've been drinking more water. I've been drinking more and more water lately, and I'm still not drinking enough.
Me too.
I'm still not drinking enough. You know, I run a lot. I ran track in high school, and I've been like on a journey to like get my speed back since about 2016. So that's really what I do in the summer times. And like when I go on vacation, we go on vacation, I try to run. And in the winter months here in Chicago, obviously can't do that outside. So I run on a treadmill. So I read that, you know, like similar to literally what you just said, like even just a walk for 15 minutes a day can help strengthen, you know, your heart.
It does. I mean, you know, and it strengthens, you know, your heart. It strengthens your joints, your muscles. And honestly, it helps the brain. You know, it releases what we call endorphins. That's like the chemical, the hormone in the brain that gives you the feeling of pleasure and, you know, feeling good about yourself. So, you know, and that's one way that our body relieves stress. You know, once you feel good that you did that walk or you get that power walk in, you know, already your body is less stressed.
My last question that I have for you is, you know, you're from Harvey, Illinois.
Harvey World, yeah.
All those siblings, you know, single mother.
Mm-hmm.
Medicine chose you. You didn't choose medicine.
Yeah.
You know, you felt isolated in, you know, undergrad. You felt that you got a low MCAT score. You know, even right now, you're the only Black woman in your residency.
Yeah.
What's a central motivation over all of that? Like you said, you wanted to be a surgeon, but what was the motivation to get to where you are now and to continue on that route to ultimately being where you want to be? What was that central theme over your entire life, if you can reflect on that?
Yeah, it is to come back and work for my people. Yeah. This is actually what I want to do. Like, to me, it would be perfect. I could, once I finished all my training, is to go work at English. You know,
literally go back home.
Yeah,
literally.
Yeah. Because I truly believe if I want to change something, I have to be a part of the solution. You know, like we don't have no more time for lip service. Like it's too much going on in the world. Like we are so talented and so full of genius and potential. Like as Black people, there's nothing we can't do. So if we really want to change our communities, we have to be in the community. So when I have, you know, my dark days and I'm exhausted and, you know, I had a long, stressful, you know, day in the OR, I think about home. I go and go on Facebook and look at your posts, you know, it makes me laugh. I think about, you know, everybody at home, and this is what gets me through the day. You know, besides my family and my husband, and, you know, knowing that God put me here for a reason. And I think that reason is to, you know, to help people who look like me, who help people who don't have the things, you know, that I did, you know, who weren't rich, you know, don't have health care, and, you know, who come for disadvantaged backgrounds. You know, that's who I want to be. You know, that's the place where I want to be. So I think for me, that's been my biggest motivation and really my inspiration to keep going.
You know, a lot of us don't think that way. Like a lot of us do. Let me correct myself. A lot of us do.
I think it's becoming, people are
more
common. See it now. Yeah,
it's becoming more common. But just to hear that's how it should be. That's how it needs to be, because we have to go back and rebuild the wall. You know, it kind of reminds me of my favorite biblical story, the story of Nehemiah, and you know how he literally left the king's palace to go back to Jerusalem to build the wall.
Yeah.
Because that was the home of his ancestors. And that sounds like exactly what you want to do. You want to go back to Harvey, Illinois and build the wall.
I do. And, you know, there's so many of us talented from like Harvey, Markham, and Dog Riverdale. Like there's so much history of us there. And, you know, and the community, they're just not thriving because, you know, the population isn't where it once was. And, you know, there's a lot that we can do to make it better, you know, to make our communities better. You know, when I would say, when people ask me where I'm from, and I would say Harvey, they probably don't know what Harvey is, of course. I'd say, you know, it's a suburb of Chicago. immediately when I say Chicago, they think of gangs, they think of violence, they think of, poverty. And at first it used to anger me. I used to get really, really upset about it. But now it's a badge of honor. I'm like, yep, I'm from Harvard. Yep, I'm from born south side of Chicago. Yep, I was from all of that, and look where I am now. Like it used to upset me so much when the first thing that people would say when you say Chicago is gangs. It's like there's so much more to Chicago than that. But even not so, like even if that weren't so what? Like I'm from there. You're looking at me, but you're thinking about violence. You know what I mean? Like it's retarded, but now I just see it as a badge of honor.
They're still looking at a doctor.
Exactly. Yep.
If this podcast has benefited you in any way, shape, or form, as always, I ask for two things. Number one, leave a 5-star review. And number two, pass it on to a friend who may benefit from it as well.